So, well, sure, welcome to the board, and
Thank you.
really appreciate you volunteering to serve on the board.
I'm excited about it, actually.
So Pam's a nurse practitioner. Before she was a nurse practitioner, she had other jobs, in fact, other careers, but one of her early occupations was working here at the health department in the maternal child health activities as a home visiting nurse. And more recently, after a long time of private practice, we're now instructing nursing at Missoula College.
Yep.
Do you have anything you'd like to say?
That's pretty much it. It feels good to actually be back in public health arena, so I was very excited after talking with Ellen. I think this is going to be a good fit for me, and I hope for you, so.
And then James, we met over teleconference. James Stevens is our other new board member. But since he's here in person and for the benefit of our MCAT audience, this is James Stevens.
Hello,
Yes,
nice to meet
second.
everybody. I'm not in London this time, so.
Great. Well, thanks. Welcome, Pam, and welcome, James. So I think you'll enjoy the work on this board, and I think the board does good work for the community, so thanks for that. So then we'll move on to item number 2, which is recognition of Garen Smith's long service. One of the things that we dreamed up, Garen, which sounds like you're already kind of catching on,
Right.
for just one last time, because our next item is approval of the minutes. And so we were wondering if for one last time, you could help us with
I
that.
only found one plan so far.
Well, we'll see. I think that the board may be able to beat you, but which did you find?
The first one is on page 2, the third paragraph on page, it says in 1999, the N Missoula. That's pretty obvious.
Oh, there's an N, okay. Well, let's see if you can get them faster than the board can.
So-
I doubt it.
Well, we got a cheat sheet.
Yeah, you got a schedule.
That's
But I suspect there is a hidden message in here.
So, huh.
Well, our secretary stands by to take any typos that you might find.
So, yeah. I suppose, and we don't have to just pick on Garen, I suppose.
I see on page
I'm looking
3
for obvious ones real fast.
that there is a typo in the 4th sentence. Montana has 2 O's.
Montana.
Where's that?
It's on the 3rd page, 4th sentence down from the top.
Montana.
Montana.
Oh, extra O.
Yeah, that's suspicious.
Yeah, and then on that same page, under public comments, board and staff comments, there's 2 R's in Sanders County.
That's showing a pattern here. You've probably hidden the word argon. Probably the
No,
only
it's not
chemist-
argon.
No, it's not argon.
Probably the only chemist who can anagram his name.
That's probably true.
Just noticed that.
You can also anagram it into the word grown, which usually goes along with most of my jokes.
So,
Like, did you hear about the Spanish magician who said, "I'm gonna disappear on the count of 3. Unos, dos," and he disappeared without a trace.
Oh, I like
Must have got that one.
And it's actually a Canada joke that I picked up.
Okay, we have 3 typos. You getting this?
There should be probably a G somewhere.
So,
You're already missing one, you guys.
That one's on the bottom of page 4, if you need to find that one.
on page 4.
Printed or motion.
Oh, yeah.
Targeted gaze management. Oh, there we go. Even a capital G.
Yeah,
So,
it's got nothing to do with nothing.
so somewhere we have an errant A.
I actually found one back on page 2, unless it's intentional. There's an exclamation point at the top of the first paragraph, that we would be very excited that the resolution would be forwarded to the city and county, little exclamation point. I'm not sure if that was intentional or not.
Maybe I found this one because I'm an attorney, but on the last page, page 6, there's a word I've never heard of. It says the Board of Health discussed the litigation.
Yeah, it's like libation, only it's.
That's what we do.
Litigation, right.
Do you know what that is, Anna?
Yeah, I can't talk about it.
Gonna have to close the board
Yeah,
meeting.
close the
I'm not gonna go there.
There's an E that's not capitalized at the top of page 6. Second line, Ellen, I think you capitalized.
Oh my goodness, you didn't capitalize my name?
I'm sorry. And below that, temporarily adjourned, temporarily is.
That's the Italian form.
Yeah.
I think on page 6, the first sentence there with the paragraph that starts board and staff comments, maybe it's, the old English spelling of recommended with an A, recommended.
Where's that?
On page 4.
Page 4,
4.
right after the bolded board and staff comments, kind of middle of the page.
Oh, recommended.
Recommended.
Here's that errand A. But there's some extra letters there too.
I don't do the minutes, I just.
I think we got all the errors. I don't know, maybe we don't. Maybe there's another one.
On page 3, under board and staff comments, did we get the extra R and the counties are Sanders?
We did.
Okay, we got that.
Got that one.
Oh, I see one. On page 5. Top of page 5, Director Leahy announced the board will need to nominate a new NEN voting.
Men voting.
Huh. Well, there you have it.
It's definitely an interesting group of typos.
I see smoke coming out of Garen's ears. Certainly you figured it out by now. Yep.
I think we may have missed one on page 6. Did we already talk about temporarily adjourned?
Yes.
Mhm, we did.
Oh, yeah, we had an I when we should have had a Y.
Somebody was really careless in typing these up.
Well, you might have been wrong, Garen. Maybe there was no message in there for you. I don't know. Did you see one?
Let's see.
This is how we feel when you do chemistry in front of us.
That's usually misspelling.
For a good reason. Pam, nice to meet you.
I don't know if I'm catching the significance yet.
Well, should we press the buzzer?
We
Thumbs
might,
up?
we might have to press the
Press the
buzzer.
buzzer?
have to.
Time's up.
All right, time's up, we're pressing the proverbial buzzer.
It backwards, starting with the exclamation point. It says, "By Garen." And it's missing the comma between
But
by
it's-
and Garen, because I didn't put it in there.
You spell by,
B-Y-E.
B-I-E?
B-Y.
No,
The
that
error.
was a trick.
That was a trick?
That was a trick, because
I was supposed to
it's
put the Y.
supposed to be a Y, so there's no rules to this.
Okay. That's why I was, not only are you putting extra letters in there, but you're
I was really
putting
making
in
it hard.
a substitution site for.
Well,
It's
with
complex
that.
algebra.
One word.
Well, we mean by Garen with an exclamation point. So with that, if I could say a few words and then turn it over to the chair. I looked on the internet to find what I thought was the best picture of Garen, and by that I mean the most representative picture of Garen as we know him. And we'll have this as a backdrop. In his wizard suit, rolling quickly away from the blaze.
I
that
had
he
bad
just set.
indigestion that day.
So, I did go through, Garen's been with us for 25 years. We appreciate every board member, every meeting, every committee, every set of minutes. And 25 years is a quarter of a century, and I grew up with Garen. So I went back to the first board meeting, July 1992, to see what were we doing, and it's not real different than what we're doing, although I think we've made progress here and there. And that very first meeting, the board heard about radon home test kits, which we had just started, and the discovery that over half, exactly 52% of those randomly self-chosen kits showed radon at greater than 4 picocuries per cubic liter, so.
You
much as-
eventually found it above that level in the basement.
Yes, in our own basement of our own building, so we have active radon removal. There was a resolution, I regret to look back and see that the resolution regarding irrigation ditch safety was put forth, but it also addressed herbicide use and exposure in the ditches, which has been addressed in the Water Quality District and the board. There was a petition from dozens of neighbors in the Woodland Park area to get rid of a house considered to be a fire hazard, and extensive discussion among the attorneys on the board as to whose job it was and whose authority it was or wasn't to get rid of the house. That was not resolved at the meeting. And this is kind of sad, but we had received an award back then for what's called the Miami program, which we had just got put into statute. Miami doesn't stand for Miami, Florida. It's the Montana's initiative for the abatement of mortality in infants. And we were really excited to get the award for being one of the pilot sites and showing that we could reduce low birth weight and failure to thrive in infants. So as you know, that's all at risk right now. And our budget was about $1 million, much bigger now. Continuing on, won't do them all, obviously, but it's just really fun to look back and see the glove rule in the health code, the hands-off glove rule after a hepatitis A outbreak that happened when people were going to Sturgis, and so carried itself all the way down to Sturgis. And we put the glove rule or the hands-off rule in place against tremendous pages and pages and pages of opposition. Health code waiver to protest, or to waiver the right to protest connection to sewer. Notebooks of opposition has since resulted in numerous properties being connected to sewer. Our first look at a wellhead protection ordinance before we came to better understand that just protecting the wellhead and this aquifer wasn't going to be fast enough. A chemistry analysis of de-icer for use on streets. The removal of the Missoula Village West Trailer Park. The board took a resolution and legislative advocacy against Montana's sexual deviancy law. All these things are just old history now, but Garen was a part of all of these, and both the science and the advocacy. Numerous meetings over the years on Malfunction Junction. I think we spent 20 to 25 years on that. Carbon monoxide redesignation. a big investigation into whether or not it was legal for Helena to ship their garbage to the landfill here in Missoula. Oxyfuels, E. coli outbreak of '95, the Albertine chlorine spill of 1996, wherein Garin was called in to see if there had been the creation of chlorinated compounds by the mix of the chlorine with the potassium cressolate, and he took a sample. We got a sample for him, and he took it to UM and proceeded to clog up all of their equipment. Lawsuits against the Montana Department of Health over the Craft Recovery Boiler, which Marnie prevailed for us on. The PM 2.5 speciation study done in 2004 with Tony Ward, and Garin was, Tony, I think you were the principal investigator on that, and Tony Ward is now the head of the School of Public Health. We had a crypto outbreak with our new pool, and the 2008 restoration of the Blackfoot Rivers, and it goes on and on. But all along the way, there were some creative learning opportunities, or I will say exposures, to Garin's curiosity. At one point, when we were working on the first smoking ordinance 20 years ago, he wanted to demonstrate that even when you can no longer smell the smoke, it's really there. You're breathing this stuff. So he brought some volatile, rank. It wasn't a mercaptan, but you brought the most rank.
Bioethers.
Oh, and he opened the jar so that we could all gag on it for the rest of the meeting to prove his point. Smelling is believing was his statement. At one point, he blew up some combination of other chemicals that was so shocking that I don't remember what you were trying to teach, but something blew up with smoke alarms, and I don't think it was in this building. At one point, I watched him vote aye on a health board measure. We then convened as the water board and voted nay to the same measure, and got the whole board to go with them because we had to learn that we were wearing different hats at different times. When we had the Northside Smell 2 years ago, he conducted a sniffing lab in a panel where residents came in and they smelled different chemicals to try to identify which closely matched the stink. And at one memorable journal report, he taught us why Twinkies won't rot. So that's what it's like to work with Garin. In metrics, he's attended up to 300 meetings. He served as a vice chair or chair for most of those meetings. He's proofread up to 900 sets of minutes and has found typos, or what he believes are typos, in 99.9% of them. Garin, in all seriousness, I have so appreciated, as we all have working with you. You have brought to the board and left with the board a very strong science base that we all share, mission focus, and you've been respectful of public service at every step of the way. So I really appreciate it.
Thank you.
There's a little memento from all of us, the board and your colleagues.
You didn't have on the list that I voted with the board to sue the state board on which I sat at the same time.
Yes, that's right.
So I voted
You
to
sued
sue myself.
yourself.
And I got over to Helena for the state board meeting, and the attorneys there said, well, usually you just have to recuse yourself in a situation like this, but we're not even gonna let you open your mouth to say that. We've never had anyone in a lawsuit against us.
And we won that. We won that one too.
You did, you did.
So this is a very small, but we hope meeting.
Come on up, Garin.
Okay.
Yeah. While Garin's walking up, I just want to point out that I've really enjoyed working with Garin. I've served on the Board of Health with Garin for, I think it was about 11 years. And Garin was a tremendous
Thank you.
leader and mentor for me on the Board of Health. And prior to that, when I was on the Water Quality Advisory Council for a number of years. So it was great working with Garin, so.
Should I open this?
Yeah.
Yeah, please do.
I had some spatial relationship challenges with the wrapping.
I see. I'm going to use the scissors here to
It was late last night.
make it efficient. Well, I had many, many adventures with the board. And it did help me feel like I was doing something for my community, which was important to me. Oh, and look, everybody signed it. So I'll read those later here.
Before the box I was going to use wouldn't fit it. Put a limit to it.
Oh, wow.
Almost matches.
It does look like something my husband would wrap.
I was gonna say, that's how I wrap. That's not how you're supposed to wrap?
Okay.
He calls it recycling.
It's inside here. Ooh. Element number 29. Gee whiz.
Oh.
Oh, and it says Salus Populi Suprema Lex.
Didn't the Board of Health vote to ban those at
Is
bars?
that
Should
lined
be
with
food-
tin? It should be
The
lined
health
with
of the
Should be
tin.
food safe.
The health of the people is a supreme law.
Okay. I got
I thought
Suprema.
you would want that for some of your gee whiz incantations that I've seen.
And it's engraved Gee whiz.
So I give you that.
Is my alter ego.
And here's your real ego. Your real self.
Ah. Well, thank you very much. Those are great.
One loud round of For He's a Jolly Good Wizard, you have to do it. For he's a jolly good wizard, for he's a jolly good wizard, for he's a jolly good wizard, that nobody can deny.
I should have brought some wizardry.
I am a little disappointed you don't have your hat on.
Send-offs, and so we have you, we didn't know what to do.
We didn't know how to make
You made it.
Ah. Well, thank you so much.
Thank you so much.
I valued every minute. I'd say it was always enjoyable.
No, it wasn't always.
I came into the room several times with hordes of very angry people, which just said we haven't done enough work yet.
Yes.
And usually by the time we got to the point where we were actually taking the vote on the measure, the audience would stand up and say, we got to have our say in this, and we think this is a good plan now, and that's the best way to do it. There's too much opposition, you haven't had enough conversation with the public.
So good luck in your real retirement.
Well, thank you.
And thank you again for the people that came on board. It's all ahead of you.
I'm doing lots of travel, teaching a Molly course, doing lots of music. So, thank you.
You have big shoes to fill.
Might be impossible.
And a big wizard hat to fill.
He's got the science, no doubt.
Thanks again, Mary.
Thank you.
Mm-hmm.
Slow down, my Jim, slow down.
Top of the minutes.
I've got everybody but Jim.
As you guys all know, I can organize them or captains. That's easy.
Just don't bring them in here ever again, please. Thank you.
Well, item number 3 on the agenda is we've already reviewed the minutes, but we need a motion to accept.
Would you like them corrected?
I think you should adopt them without correction.
Okay. I'm fine with that, it's up to the board.
It's up to whoever wants to make a motion.
I'll make a motion to accept the minutes uncorrected.
And thank you.
In memoriam.
All right. All in favor, say aye.
Aye.
So moved. All right, item number 4, February Journal Report, which is, are you doing that?
I'm doing it.
Awesome.
So this is going to be less exciting than non-rotting Twinkies, but I'm gonna pass out something that'll become evident in a minute. But I thought we could talk a little bit this month about e-cigarettes, given that at our last board meeting, part of the sort of proposed revisions to our air quality ordinances in Missoula County would be adding e-cigarettes to the indoor air smoking prohibitions here. And I, last spring, attended the annual meeting of the American College of Preventive Medicine and attended an interesting session, public session, that was focused on sort of formulating the policy of the National Preventive Medicine Academy on e-cigarettes. And it's kind of been rumbling around in my head, and then we had our discussion, and there was also this sort of editorial in the New England Journal about e-cigarettes, the title of which is E-Cigarettes and the Harm Reduction Continuum. And it's sort of getting at this idea that we're in the midst of kind of a shift and a lot of debate in terms of tobacco control policies, and specifically what we should do with the regulation of e-cigarettes to protect public health. And we have been in a mode for a long time where we have kind of been in what I would sort of term precautionary principle mode. There's no safe level of exposure to burned tobacco smoke. All of our public health policy has been focused on really trying to eliminate exposure as much as possible, and now we've got this product that's different, and it's making some waves in terms of conversations. And I'll just sort of read one paragraph that kind of highlights the nature of this editorial, and then talk about a couple of other things. So the authors start here. At the outset of the debate about e-cigarettes, the harm reduction concept sharply divided the tobacco control community. Many saw in e-cigarettes a Trojan horse that would slow the process of smoking denormalization, reduce the number of people trying to quit, and seduce young non-smokers. Others saw a disruptive technology. Public Health England, supported by Action on Smoking and Health and the Royal College of Physicians, placed harm reduction at the center of its tobacco control agenda in 2015. So there have been differences in how people have approached the regulation of e-cigarettes, and it's still largely sort of unsettled in this country, especially at the federal level, where about 6 months ago, the FDA sort of pulled back on their regulations to propose sort of regulation of e-cigarettes as a drug delivery device. And they said, we're going to put this on hold. We're not sure if this is the right thing to do. So I'm going to get back to that in a minute and talking about regulations, which is what you all have in front of you. But I thought it'd be useful just to talk a little bit about the science of e-cigarettes, as unsettled as it is right now in terms of what we know. And I found a recent review article. It's actually a little dated now. It's from the beginning of 2017, but it was sort of the best, most current comprehensive review article I could find. It's sort of an extensive review of the literature. I think it was a record for things I've come across, and that they're they actually reviewed 800 and some papers for this review article, kind of trying to summarize broadly the literature on e-cigarettes. And they sort of reached 7 main conclusions about e-cigarettes. The first was that this is a diverse group of products, so it's hard to study. There are several different manufacturers, several different devices. The things that you buy that are sort of all, one commercial thing that looks sort of like a burned tobacco cigarette are very different than, the various vaporizers where you pour in liquid to them. So it's hard to study. The second conclusion they drew from this extensive literature review is that there's clearly harmful stuff in e-cigarettes. They're dangerous chemicals, there are toxins, there are bad things in e-cigarettes. It's also clear that there are many fewer of those bad things, and perhaps an order of magnitude less than in burned tobacco, which kind of gets you to the harm reduction argument. The third thing is that, even though e-cigarettes are relatively new to the market, there are sort of published adverse events, poisonings, things like that have been associated with e-cigarettes. So there clearly is, there have been documented harms in addition to the sort of the theoretical, there are dangerous chemicals in these things. The fourth sort of big summary they made is that, with the advent of a new product, we're now about, depending on when you count the first of these showing up on the market, less than a decade into them really being widely available. There's been a dramatic increase in advertising, a dramatic increase in youth. We've talked about that at this meeting in particular, and that's a trend that really concerns a lot of people, and I think is leading to a lot of the rub in this debate about whether we err more on the side of preventing anybody from using them or reducing harm. But the other thing that they found is with this increase in use, still most e-cigarette users and most daily users in particular are current smokers. The last couple of points that they made are that there is evidence, but at this point still a fairly weak body of evidence on the use of e-cigarettes to help current smokers of burned tobacco quit or reduce their use. So it's out there, it's not overly compelling. Frankly, the data on use of other nicotine replacement isn't overly compelling, but it's out there that there is some evidence that we might, get people that are using a dangerous product to substitute this and make it less dangerous. And then the last thing that they sort of draw as a conclusion is there's been a fair amount of research into regulation of e-cigarettes, but there is not a lot of settled science yet about how the various strategies for regulating e-cigarettes ultimately impact use either of e-cigarettes themselves or of sort of the broader public health impact of e-cigarettes plus tobacco together. So I found this interesting just from the standpoint of, many of the things that we assume are still not largely settled science with respect to e-cigarettes, and we're still very early. We're not going to have, decades of data on health impacts like we have with burned tobacco, but yet we're in this regulatory environment where we're trying to develop policy. So that brings us to the table in this article, and these authors said, in this tension between assuming a precautionary stance where we just try and do with e-cigarettes what we've done with tobacco and limit all use in any forms, and the sort of least restrictive end of the spectrum where we'd be looking more at a precautionary or a harm reduction approach and saying we want to make them available enough that anybody that's using burned tobacco uses e-cigarettes instead because they're safer. How do our regulatory policies fall in that spectrum? And they have a whole array of things here that are sort of potential policies that have been debated. Everything from on the most restrictive side, allow e-cigarettes that don't have any nicotine in them only, or only allow them to be sold to people who are already current smokers. I don't know how you'd ever do that. Or regulate them tightly as a drug delivery device and only allow them to be sold in pharmacies, to, at the total other end of the spectrum, actually have public health messaging that says, this is harm reduction, it's safer than using burned tobacco. And as hard as that is for many of us to probably swallow, as hard as that is for myself as a doctor to swallow, it's what we do in other places where we promote harm reduction. They're sometimes controversial, sometimes not, but we do it with needle exchange programs. We do it with methadone and Suboxone for treatment of opiate addiction. If you want to think of it this way, although it's not a great parallel because there are inherent goods with driving, we do it with seatbelts. Seatbelts are a harm reduction strategy. So interesting, and I think that this last thing I'll say, and then I'll end the journal report for today, is we are somewhere in the middle in Montana, and we're kind of muddling through this as a lot of states are. So there's a great sort of website, the Public Health Law Center, that sort of has a section on e-cigarette regulations, and you can go and look by state, and they have things broken down in a number of categories. And this is sort of, in their categorization, how Montana stacks up. So we have defined e-cigarettes, but we've not labeled them as a tobacco product. So they're sort of in this separate regulatory place in terms of our state law where, the vapor products is what our state calls them, are regulated separately than anything the regulations that would apply to a tobacco product. We've not chosen as a state to tax them. There are conversations about whether you should or shouldn't. There are some people say, well, you should tax them, but tax them less than cigarettes. Tax them enough that, the barrier for a high school student buying them is high, but tax them less than cigarettes so that somebody that's a current, 2-pack-a-day smoker will have a financial incentive to switch to e-cigarettes versus cigarettes. Controversial. We don't do anything in our state. We don't have any regulations in place for sort of packaging or marketing. Even basic consumer safety regulations don't exist for these in terms of making packaging child-proof or anything like that. That's one of the non-controversial things that's happened in a lot of other states. We in Montana have restricted youth access, so you can't, sell them to anybody under the age of 18, and they're supposed to be verifying age and ID just like they do with, sale of other tobacco. You do have to be a licensed retailer to sell them. And in some places statewide, they've sort of applied, indoor air smoking bans to e-cigarette use. We're sort of evolving in that direction, it sounds like, in Montana, where a number of the metropolitan areas have done this, but it's not, it doesn't exist at the state level. So I don't have an answer. I think the controversy is interesting, and in that heated discussion in the room at the College of Preventive Medicine, I found myself often kind of on both sides of the fence, and find myself on both sides of the fence in clinic when I'm dealing with how to help my patients that come in who are smokers, and my teenagers who I want never to touch anything with nicotine in them. So.
Did you see any data in regards specifically to secondhand or passive smoke?
Not a lot. That is mentioned in this review article, and they talk about it in the section where they're talking about, the effects for end users as well. So I don't know that there were great studies of secondhand smoke. They have a hard time even in end users detecting sort of measurable biomarker changes. So looking at things like after you smoke an e-cigarette, does your blood pressure go up, or can they measure toxic chemicals in the blood? They have a much harder time doing that in e-cigarettes with end users because of the lower concentrations of some of these things. But it is a risk and a concern. I would say that, sort of the same thing as with sort of end users, the magnitude of risk from exposure to secondhand smoke versus secondhand vape, if you want to call it that, is probably dramatically different. But I think like with burned tobacco, our public health interest in protecting somebody who's not a voluntary user is very different. We've used that justification to, say even levels of secondhand smoke that are much less risky than what a primary smoker uses. We have a public health interest in protecting people from even that level of smoke. So it's a whole order different, but it's not zero. So it's gray and it's hard.
The technology impact's pretty heavy too, because the original e-cigs designed to only do nicotine are much lower temperature. The ones designed to vaporize illicit drugs such as THC or methamphetamine, they're much higher temperatures, and so they cause reactive chemistry on the propylene glycol and the other materials in there. And some of those reactive chemistries, the MSDS on the molecules just say it causes death. So,
Right.
It really depends on the technology. If you have a high temperature one that someone's using to smoke hash oil with, the chemistry that occurs in that is radically different than one designed just to deliver nicotine.
Yeah, and I think that's part of the variability that makes this really hard is, something that is sort of a complete encapsulated packaged product that's manufactured somewhere, it's much clearer to understand what you're getting. But if you're buying something, at the vape shop and who knows what you're pouring into it that's, getting burned in it.
pretty much there's two major base materials they use. They either use vegetable glycerin from the biodiesel industry that's contaminated with sodium hydroxide, or they're buying Chinese propylene glycol because it's dirt cheap and who knows what's in that.
Yeah.
Well, I'm just thinking about the delivery devices themselves, and once you have that type of catalytic reaction with metals, let's say you're in a car with an infant, is there any heavy metals contamination type? Yes.
Well, they do explode as well.
Yeah, they do. And I mean, that's part of the case reports.
Good, bad, or indifferent, there's a whole article on how people are buying flavoring chemicals off Amazon and trying to smoke them because they think it's e-cig juice, and it lights the e-cig on fire because it's just ethanol and flavoring compounds as opposed to being nicotine and propylene glycol and all that stuff that's used. I mean, it's a fog machine you're using to inhale a psychoactive substance, so.
That's another whole sort of scope of regulation that we haven't touched here, that many places have sort of tried to carve out that middle ground. Is, you know, do we try and regulate the flavorings and some of those things to make these products less appealing to young people and less appealing to people that are not current smokers?
I think there's a lot of regulatory structure that could even be used, because if you just force the e-cig providers, if they're using flavoring compounds, to follow food safety laws, most of the manufacturers don't even follow food safety and wholesale manufacturing laws. Therefore, you could eliminate the supply almost immediately by enforcing other aspects of the law too.
And then if you had to obtain them through the pharmacy, just like you do nicotine patches and nicotine gum, that would be another layer.
That's my biggest concern from a public health perspective, is no matter what you do, you're still encouraging someone to use this psychoactive compound that's known to cause addictive things. Pulling the NIH studies up,
Yeah.
It is like the second or third most addictive compound on the planet, supposedly.
That's a very timely article for the
Yeah.
Smoking ordinance has been put up for hearing
Yeah.
at the end of the month by the city council.
And most of the public correspondence I've already received are people asking us not to ban vaping in public places because they're using that as a substitute for burned tobacco.
Interesting.
But as you said, they're probably smoking both.
They probably are smoking both.
Right.
And in the literature and users, that was one of people that are using e-cigarettes. And granted, this is data that's several years old, so as you know, indoor air smoking or indoor air quality encapsulates e-cigarettes, maybe this will be a less common reason for use. But one of the top reasons for use was to circumvent
Right.
air quality
And I think it'd be very
regulations.
difficult for businesses to determine where the smoke's coming from.
Mhm.
It's gonna be fun.
Yeah.
All right, appreciate that, thanks. Thanks, Rob. So then we have to identify a volunteer for the March Journal report. I may or may not be here, so I'm out.
We have
so.
2 new members.
Normally I would, but I'm going to be in Nicaragua, El Salvador, and Costa Rica right before the meeting, so.
There you go. I guess that leaves me.
If you want to do it, then do it. So,
I occasionally give one when we've been through it.
yeah.
No, I think any journal report, or if you want to summarize your trip with the nurses, would be interesting.
When Garen used to travel on the board, and it got more frequent the later years on his board, he would sometimes do journey reports.
Yeah, slideshow.
I like that. I think I could do that really well. Yeah, so I took nursing students to Nicaragua, and that may be something that would be.
Yeah, absolutely.
Can
All right.
I take a moment to apologize? When each of you came in for orientation, you may or may not have met Kathy Potlin and Julie Moore. Julie was on a medical leave. But you certainly did not meet Anna Conley, our attorney, aside from so I'm sorry that I was rude and it didn't occur to me
Well,
till
last month, I think I just was on a portion of the meeting.
The conference call.
So. We should go.
And with some of the activities we've had lately, we worked with Anna quite
Yes, we need our own attorney.
a lot. A lot, because we got between the Smurf and Stone and the Fool's End Club and things like that, we have to consult with our lawyer frequently, which is great. Anna's phenomenal. I enjoy So with that, one thing I noticed while we were going through the journal report that a group walked in, and kind of got a tradition of having the group introduced, and then for the group to kind of introduce themselves quickly, saying where they're from, their names and where they're from. So who wants to introduce? Who knows who this group is, and who wants to introduce them
Think
to
they're
us?
instructors.
So I'm Marcy Hansen, and I am the course coordinator for the MSU Community Population Health Nursing course. So these are my fantastic students who will be graduating in May. So they are learning all of the wonders of public health and joining the meeting today.
Yeah. So one of the fun traditions we've always had is when a group like this comes in for each member of the group to briefly just say who they are and where they're from, and there you go. So somebody start.
I'm Sarah Nestor and I live in Plains.
Great.
Sarah Metzger, I live in Missoula.
All right.
I'm Madison Hansen, I'm from Glasgow, Montana.
Clayton Patty, Missoula.
All right.
Amanda Bossy and I'm from Wisconsin.
She said.
Jean Rowie from Billings.
Aaron Snyder, and I grew up in Conrad.
I am Trescott from Coeur d'Alene.
I'm Darby Garner and I'm from here in Missoula. I'm Samantha Racine and I'm from Billings. I'm Kirsten Kreitz and I'm from Great Falls.
Patrick Mardiak from Missoula.
I'm Fawn Wilder, I'm from Judith Gap. Melanie Hoke and I'm from Missoula. Lauren Byrne and I'm from Missoula. Emma Divier and I'm also from Missoula. I'm Catherine Baker, I'm from the Seattle area. I'm Dallas Flagger and I'm from Spokane. I'm Michaela Fiore and I'm from Missoula. I'm Sydney LaValle and I'm from Lake Taos, Washington.
All right. Great. Thank you. Welcome. So then we move on to item 5, which is an action item, which is the action to appoint Board of Health Liaison to the Maternal Child Health Advisory Council. And Ellen's going to lead us through that.
Pam and I did talk about the possibility of her interest in that, which we do have in the scheduling. So it's, if you've made a decision or not, the board can look at that today.
I would be pleased to be on that council.
Great. Great. So is that?
It's actually listed as an action item. I don't believe there's any bylaw that
That's what I was-
requires it that way, but we put it that way.
Yeah.
A motion.
Yeah, so just to stay on track with that, we can then entertain a motion to appoint Pam as the liaison.
I'd move that we appoint Pam as our board liaison to the Maternal Child Health Advisory Council.
All right.
And we don't have a requirement for seconds on this board.
Okay. Yeah, so, any public comments on the motion on the floor? Seeing none, all in favor, say aye.
Aye.
So
That was
moved.
fast.
All right.
Seeing none.
Thank you.
Thank you,
I didn't
is
see
one.
So, all right, thanks, Pam.
Mr. Chairman, our introduction of our new outpatient clinic manager, Colleen Morris, needs to be put off. She's out for illness.
Okay, all righty. So then we'll move on to item number 7, which is monthly updates on the strategic priorities. Section 1 is the population and health status, goal 5, immunization billings. Sarah, I guess is where you
Made you a PowerPoint. So I need that, so I don't know what I'm talking about. And Colleen was supposed to help with some of it, so I'll that for her since she's not here. Thank you.
This is our third year, second half of the third year of a 3-year strategic plan.
Thank you. It felt like this has been a while. So I'm gonna just give you a quick update on goal 5 and goal 6. So goal 5 is for immunizations. This is the billing goal, and we had said by June 30th of this year that the billing process for immunization services will receive 80% of our collectible charges. And of those, we have one objective that said by October 2 years ago, we would select a new electronic health record system for health services, which would include our clinic and our home visiting. And so we did do that. We used the Missoula County procurement policy and went through the RFP process with bids and responses and narrowed it down to a total of 2 that we interviewed and ultimately selected 1. So we made it all the way to there. I believe we signed the contract in December of 2016. So we're a little off target on there, but it's been signed. The second objective was by December 1st of 2016, we'd begin the implementation of that new system. So we're a little off on those dates, but we're moving forward. So we began that implementation and training of phase 1 with our outpatient clinic and the billing and practice management associated with the immunizations. We went live June 15th of 2017. So we were about 6 months off that time frame. The home visiting phase, we're currently in pilot process. So we just implemented pilot 2 today. We did some staff training with the super users, and we're getting that feedback over the next week. And then our projected go live for home visiting is in early April. So we're anticipating that hopefully we'll all be transitioned to the system, I'm hoping by the end of this fiscal year. So barring any other big roadblocks, but we're trucking along with home visiting. So that's all for this goal. Are there any questions on the EHR system and the process and where we might be? Great, moving on. The second goal is community awareness, and so we had said by the end of June this year that we would have a detailed outreach campaign to increase community awareness about public health impacts of vaccine preventable diseases and the immunization services provided here at the health department. We have one objective related to this, and we said by June of last year we would identify collaborative opportunities with local partners and statewide. We did submit a community health excellence grant to Pacific Source, which is one of the insurance companies. We were not awarded as a recipient, and we chose not to reapply last year because we were in the midst of going live with our EHR system. We have been working with Montana DPHHS for their HPV awareness and participating in any kind of outreach effort that they are instituting. And they've given out some incentives, which we then present to the Missoula County winner, and our most recent winner didn't want to be photographed and published, so he came and collected his card and went on his merry way.
Do you want to say out the acronyms for the audience?
Yeah, HPV is the human papillomavirus vaccine, and then Montana DPHHS, Department of Health and Human Services. So we'll continue to work with the state on those projects. And then we had said select at least one additional community outreach marketing method to implement based on our year 1 plan. And with the amount of time that the EHR rollout has taken, this has taken a lesser priority. One of the things Colleen started to look into, she's only been in her position for about a month, is she had communicated with Gallatin County Health Department. They have a community immunization coalition made up of a variety of people, including providers and teachers and things like that. So she was getting some feedback on how they started that and how to make up that coalition. And we did a survey at the new year to our VFC partners in Missoula County to see if there was interest. And so we're going to move forward with that this year and how we can figure out how to set up a coalition. That's not a piece of advertising, but so we still need to look at that. But that's part of our outreach and being connected with our community partners and advocating for immunizations. So,
could we partner with a local nonprofit to get it so if anybody like a radio station or TV station, if they donate time or airtime to it, they can use that as a tax deductible vehicle to get this message out?
I don't see any reason why we couldn't.
That'd be
do
cool.
that.
So that would be my priority, is to find a nonprofit partner who wants to work with you, so then it can become a tax deductible donation from different vehicles, to make sure that we can get that out there and have it be a benefit to the community, getting the message out while kind of benefiting those businesses who donate their services.
Although I think you can donate money to a city or county and it's passed through, it is not, it depends on what the funds are, because if they're community benefit funds from like a bank, we're not considered a nonprofit by their standards, but it is, sometimes they can write it off because it's a pass-through, because we technically don't make profit.
I'm thinking radio, right? Some people
Yeah.
still seem to listen to radio, at least in their
Yeah.
car. So if we could access some of those vehicles and make it beneficial for the local companies to donate that airtime, whether it's TV or radio or
Yeah.
whatever, Cherry Creek, whoever, it doesn't really matter. If we can figure out that mechanism, that might be a good way to cost-effectively get the message out.
Right, because cost is definitely one of the things that you weigh in here with this. And, you know, part of this that has gone hand in hand with switching to an entire new electronic health record process that has shaken up the entire process of the clinics. You want to make sure that that infrastructure is in place before you start advertising your service, right? So that you can see the people who hopefully come in from listening or seeing an ad of some kind. So we're getting there with that. Yeah.
Good idea.
Yep. So I think that's all I have there. Any other thoughts or questions on that?
So how are the cuts in June going to affect programs? Elephant in the room.
I'll talk about what we know and what we don't know under the director's report, but
Okay.
the cuts don't directly, because they're Medicaid for targeted case management, which affects our home visiting. Those cuts don't directly have impact on the immunization clinic itself.
Yeah, I just wondered about the
overall
home
loss of
visits. Yeah.
revenue, perhaps could. The deduction of, or the loss of some fee revenue for other Medicaid providers perhaps could, which would probably send them here.
But those home visits are safe?
No, they're not.
Okay.
That rule's not been published.
Okay.
They're not safe.
Thanks.
Thank you. All right, so now we move on to item number 8, which is update on quality improvement projects. Annette.
Hi, and thank you very much for having me here. I am Annette Van Domlin. I have been a home visitor, for those of you who don't know me, for 27 years now. And I have a big passion for quality improvement, and I'm going to tell you about some of our projects that we've wrapped up and some projects that we have going on. I Googled quality improvement Missoula, and the health department is the only thing that comes up. The only thing that comes up. So we are way out ahead of the curve in Missoula. This is a thing other organizations have been doing for a while, and I feel like we're doing an amazing job with it. I feel very proud of us. So
You're sitting next to, I don't know, several degree black belts.
Woo!
Six Sigma black belt.
Nice, nice. Well, I would like to pick your brain sometime. That would be a goal of mine. I would like to be a black belt. So, as a humble Plan, Do, Check, Act girl, our health services internal referrals, we have for health services, WIC, outpatient clinic, and home visiting, and we should be referring all of our clients internally to our own programs. We should be. We have, in 27 years, done a lot of, attempts at that, but we took a run at it with quality improvement tools, and we increased that by 975%. I like to put it that way, but we went from about 8 to 86 referrals in the same time frame, and the time for staff to do that was 12 seconds. So it was a really cool project that I was very excited about. We did a contracts processing project. Initially, the baseline for contracts being processed in 45 or fewer days was 46%-ish. We had a goal of 80%, which we surpassed, and we hit 95%. Contracts processed completely start to finish in 45 days, so we're very proud of that. Staffing the OPC clinic, this is a almost finished project. Staffing the outpatient clinic for sick leave, rush times, vacation times was expensive, unreliable, unstable, and as a result, stressful. And so we were looking at improving that. I look forward to reporting on that, but I feel, Sarah could probably speak to it better, that we are doing an amazing job coming up with a plan about that I think will be very successful and fun to report to you. That's still an open one. I could talk about the maternal child health QI project for 4 hours because that's my program and I'm super excited about it, but I will just tell you that we piloted the project starting yesterday. When you pilot a project, we have a beautiful plan in place which we hope will be successful, and it will be piloted for 3 months and then we'll get back to you about the outcome. But briefly, that project seeks to become more internally consistent with our services. If you have time for an example, yesterday I love analogies, I get this from my mom, but I feel like the home visiting services are like the most amazing restaurant in the world. But when you go in there, what you get to choose off the menu is more dependent on which waiter you get or server than the overall restaurant. And so we're just trying to make sure that when you're at our restaurant, whatever server you get will bring you the same menu. That's I think a fun way to think about it. I'm super excited to see how that turns out, I guess. I think it's going to be good. And then I think the thing that we're most excited about this year is that we have expanded our leadership. We had a leadership training. We had 3 people volunteer to be comm leaders. Prior to this, I was leading most of the projects. Robin was leading some projects, and she had done an amazing job, but she can't keep leading them. And so we trained 3 new people, and they have a total of 4 projects going. One of them is to work on the tobacco-free schools of excellence and involves the e-cigarettes. It's a way that we can get at making sure that the schools have an e-cigarette policy in place, because many of them haven't really addressed that yet. And they want to make sure that, I'm trying to think of the baseline for schools to be tobacco-free schools of excellence in Missoula County is currently 40%. I can talk maybe a little about what that means, but probably not a lot. But the project seeks to assure by the end of this year that 75% of the schools are, school districts are tobacco-free schools of excellence, which is indirectly something that we were also looking to support the schools in managing their e-cigarette policies and what do you do when the policies are violated and such. We have an air quality project going that seeks to make sure that the air, this is not my area, so I want to say it correctly, it's going to make sure that environmental health has 100% of the data that they need to respond to the community needs about solid fuel burning devices. Please don't ask me questions about that. But it's a great project. Christy's running a DUI task force project. Currently, the task force, and this is a cool project because we're seeking to bring people outside of our building, as it were, into these teams. And we have a member of the DUI task force on that team, and they want to increase the task force, I'm trying to remember how they put that, involvement in the task force, as opposed to a meeting that you attend. It's a active role. Yeah, thank you. Oh, Chrissy's right here. I didn't even see you. She can speak to that if you would like. And Daniel finally is doing a project on permitted wells. Let's see, currently they have a baseline of 25% of wells that are inspected, permitted wells in the county, and they would like to increase that to 70%. I have no doubt that they will be successful. And that is your QI update.
Board questions or staff questions or comments?
So I guess just my question is, all this data that we're accumulating and tracking, are we putting this into the GIS overlay and just kind of, to me, that'd be the most beneficial use of, I mean, we're tracking it per project, but I'd like to see a holistic use of the data.
The answer to that varies. The things such as wells have traditionally gone into that.
Yeah.
What we're more than experimenting with now finally is breaking through on data related to services or risk factors and those types of things, and starting to map some of those items that are contributors to good or bad health.
Yeah.
So the answer is really different on almost every topic. It's not, there's nothing comprehensive
But the
Yes.
answer is if it could be, it is, right?
Yes, if we
yeah.
have, right, and we can take things that have traditionally been mapped, such as where, now that we have the well permitting
Sure.
system, because we didn't have that. I don't know how long that, we've had that regulation, but the well
Yep.
siting permit. And those can be imported into the map that we're putting some of the other data on, some of the newer types of data. It can be. I don't know how far we are with those particular examples. I can't answer that.
And for the audience, the reason why I'm asking that is because it helps us drive policy decisions, knowing where sidewalks are and septic tanks and sewers and illnesses and poverty and mental health issues. Knowing all that helps us set policy. And having that on one big map.
So if you go on our website, you'll be able to find some of the health-based maps that we have made available, and some of those you can manipulate a bit. We can, in the department, can manipulate them much further.
Yeah.
So we did resubscribe to the policy map service that Robert Wood Johnson
Yeah.
Foundation developed just this year. So
It's very helpful.
We're going to try to stay on that track. And one of the arenas of the 5 priorities that have come out of the community health assessment moving into the community health improvement plan, which will be developed this year, one of those 5 is that type of sharing of data.
Mhm.
So that's kind of a new focus, I think, at that level. Thank you.
Thank
Great,
you.
thank
Thank
you.
you.
All right, now moving on to item number 9, which is instructions to complete the board's fiscal year self-evaluations.
So, in November of last year, we started to talk a little bit about doing your self-evaluation for 2017. And then I was hospitalized, and also you did not meet in December, so we did not complete the evaluation, and thus you didn't see results for it in December as we had originally planned. We're set now. Board members, you'll receive an email this afternoon that will have instructions for you on how to access the SurveyMonkey survey so that you can complete your evaluation. It's the same form, same type of questions that we've used for many years. The Board of Health actually did look at that format back in 2013 and decided that they wanted to continue on with that format indefinitely. So look for that email. It'll have the link that you'll click to go to SurveyMonkey, and it'll have the password for you so that you can log in. The survey is open from today through 5 p.m. on March 2nd. You do need to complete your survey before 5 p.m. on the 2nd. It closes, and if you're in progress, you'll lose what you've worked on when the 5 o'clock hour comes around. Then if a sufficient number of board members complete the survey, you'll go over and review the results in your March 15th meeting. Of course, for James and Pam, we recognize you're new, you haven't been involved at all during the period that the evaluation covers and so forth, so you'll be able to participate voluntarily when we do the 2018 review, which will come later this year. Also, the management team's select members are invited by the board to evaluate you as well, and they'll get their information today so that if they want to participate, they can do so.
All right, thanks, Julie. We'll move on to item number 10, Director's Report and Accreditation Update with Ellen.
So we've gone through on accreditation. We've set our own deadline in conjunction with how we understand the reaccreditation timelines. And we want to have all of our documentation uploaded. I think it's by December.
Well, it's
No.
supposed to be to me and Robin by December, and then we're gonna start uploading in
There's
January.
other real deadlines before the drop dead
Right.
deadline. So we went through the brainstorming process to see which examples and which members of our staff will be writing up many of the 100-some responses that are required. Just a reminder for all of us, just as we were early adopters of accreditation, we are now. early adopters of reaccreditation. So once again, we go into maybe not as much of a black box or an unknown territory, but it still feels that way. This is the first round of accreditation that FAB is doing, of course, and we're not going in on the first round, we're probably about the third. So that's going well. It's quite a bit different than what we went through the first time, so we'll look at ways to involve you, particularly new board members, without perhaps some of the emphatic, almost over-involvement we did the first time around, which I do believe paid off, because we all have that imprint of what that accreditation looks like. So I'm particularly open to newer board members, understanding how much you want to know and when you want to know it, so that we don't have your ears fall off on this. It's a big process. The business with, I guess I'm calling it business now, the concern with the rule, the Medicaid rule change that I talked about at the last meeting and for which you adopted a resolution is the time, it's not over yet. We did take your resolution and we did, three of us, Sarah and Vicki and I, go over to Helena and testify. I testified for our Health Officers Association for the state. We did testify against the rule changes as proposed because they would all but completely eliminate the service to that population of infants and children. We were among scores of people opposing that and other rule changes. We then sent more testimony in and also had community partners send testimony in before the deadline of February 9th. The rules have already been written but not published, written or rewritten, and they won't be published until the 23rd. And based on how they wrote the first set of rules, I expect that even if we make any headway on these rules, and I still hold hope that we'll make some headway, but I'm preparing for Plan B, that we made no headway at the same time. I think it's going to be difficult to determine how those rules are really going to affect our population because they're not written in like numerical cuts of fees. They're written in terms of this child be eligible, this child won't be eligible, and then if they also get seen here, they may or may not be eligible. And that's something that the staff is already working on to try to pull from our data what we think our population looks like so that we'll be ready to interpret it on Monday the 26th. And then we will inform the staff and the board about our interpretation. I do expect, though, you may recall that we already removed 1.5 FTEs to part-time nurses from the staff. And I do expect that even if we make some headway, we will be looking at some reductions in force. We're going forward fighting against that. And then we'll go through a process that we will then bring to the board about what our thinking is on that. And it looks like it's going to coincide with the regular budgeting process for next year because our fiscal year starts July 1 and our budgeting process in the city, the county, one starts in March, one starts in April, and we kind of live between those two processes. So in some ways that will give us the ability to look at the larger picture as we're looking at if there's a need for reduction. So thanks to everybody that keeps fighting with us. The Missoula Independent has done 2 stories. They published another one today, have shown an interest and gotten a lot of social media interest in what it is we have to say about these concerns.
All right, well, thanks, Helen. The next item on the agenda is another action item. It's accept performance management report. Christy Shields is going to guide us through it.
Hi, I'm Christy Shield, the Performance Management Quality Improvement Coordinator. I'm going to just bring up the document of our performance. Oh no, that's not it.
Try it again and,
Right here?
yeah,
It's so hard to drive it from there.
Oh, there it is.
it's a glitch that we have, that it Oh, it's a different document.
Mesh sensitive mouse. Okay. I'm going to just pull up some examples from this document. It can seem super overwhelming, but I just today want to go over, give you kind of like an idea of what it is we're doing with this document, with this report, and then also talk about some highlights that just sort of capture some important aspects of the document, of the report, and then briefly talk about some next steps, some things that we're going to do this next year. So as you probably know, our staff updates their data on their chosen measures each year. By collecting and reporting the data, we're able to track our work produced and results achieved. And this is also a way for us to manage the work that we're doing and also how we hold ourselves accountable to the work that we're doing. And we strive for these performance measures to not be viewed as just an add-on. We want it to be something that's ongoing and that the staff has a lot of ownership over. We want it to help staff know how well their programs are working, and it also helps managers and supervisors better understand what outcomes and metrics they're accountable for. And so when staff create these measures, they go through this process called, it's this sort of evidence-based best practice, the Friedman 5-step process, which requires a meeting, them to look in depth at their program, and to make sure select measures within this process, this protocol, and also ensure that they're relevant, they're easy, the data is easy to obtain, and it's useful for their program. And again, a lot is captured in this document, but I'm going to go over briefly what it does collect. So we're looking at each program, the performance measure, and then also the measure type, which is very important. And as you may recall from last year, we started putting this into the document because it was super important for us to know what kind of measure is this. Because there are some measures where you're going to see, like, we have a lot of control over a process measure, something like number of trainings. So we're going to get to that target a lot faster than something like a long-term measure that's reduced suicide rates. I hope that's clear. And so we need to keep that in mind when we're looking at the overall trend. We also collect, and this baseline for most programs was collected in 2015, and then we look at each year after that. We're currently on year 4. We're going to just continue this on. It started as a 3-year tracking tool, but this is ongoing. We're also looking at trends. And so as you can see in the trend category column, we can see the 4 years, and if you actually, enlarge it on your screen, you can see the data graphed specifically. But it shows us, it encapsulates basically how we're doing. And then the target. And so a lot of, some other things that the document captures or collects is we're also including any new performance measures. So we have 9 new program measures this year. And it also lets us know any measures that are linked to the strategic plan and CHIP, and also any projects or any measures that are linked to quality improvement projects. When we look at this document, it basically, tells us kind of on surface what's going on. But if we analyze it a little bit deeper, we can see some other things. We can analyze gaps and differences. We can compare ourselves to the national and state trends. We also can find out in what ways our programs are performing above and below our target. We also can find ways in which our performance can be improved, so we're able to identify quality improvement projects. It also tells a story. How has our program contributed to population outcomes? And what ways are clients or stakeholders better off? And then lastly, it also informs us in making decisions about the future of our programs. Some highlights from this document, and as I said, it's really easy to look at the target and look at where we are and, oh, why didn't we get there? There's so many different examples of how this can be interpreted differently. And I always like to pull out, I like to give animal control, I'm gonna move over there quickly. Animal control, one of their measures is to reduce animal-human conflicts increase licensed dogs in Missoula County. That's what I want to talk about. Their target, as you can see, 15,397 from a baseline of 13,997, has increased pretty steadily. It's kind of like the perfect example of what we're trying to do here. But it's also a process measure. And interestingly enough, a QI, quality improvement project, was initiated in 2015, completed in 2016, which really boosted their numbers in those following years. So you can see how that is clearly connected. Another example of how sort of the trend can look pretty different, and also our ability to get to our goal, would be suicide prevention. And we're doing so many fantastic things in suicide prevention on a process level, but when you look at a long-term outcome, reduced suicide rates, we're not directly connected to reducing suicide rates in Missoula County. And we're also not going to see us reaching our target, in the next year or two. So that's a long-term measure. That's something that we want to track over time. And by creating a diversity of measures, we encourage staff to include a diversity of measures so that we can not only see some of those like short outcomes, but we can also see some of those long-term outcomes too. So some highlights from this year. We had 48% of our 2018 reported data met or exceeded the goal. But more importantly, I think, is that close to 70% of the measures are moving towards the goal from their baseline. And again, both of those depend on the type of measure selected. 9 new program measures are included this year, and 15% are tied to quality improvement projects. Some of our next steps, the big goal is really to continue to improve and grow our system. And not only are we including programs that have not already established measures, but new programs that are part of the health department, encouraging them to select their measures and go through the Friedman 5-step process to do so and take that protocol. The next step that we're going to take is really take this report to the PMQI committee so that we can do a more thorough review, so we can analyze it a little more deeply. But also, the most important thing I think the committee does is identify potential quality improvement projects. One other thing we are striving to do is to not make this check the box once a year kind of thing for staff. We want it to be something that's ongoing, that staff has ownership over. And to do that, we're asking managers to revisit their performance measures annually, mid-year, and to review their data and to talk about it. And not only does that allow them to feel connected to their performance measures, but it also allows them to reflect and analyze on their measure. Is it still relevant? Are we still really able to get this data? Is it useful for our program? We now have a protocol to revise and replace our measures, and so that's something that will continuously happen, because what we want to do is we want this to be a quality product. We want something to be useful. And so if that means revising a measure for some outside external reason, then we need to go ahead and do that. I'm also going to be meeting with the additional programs to develop their new measures. And then by next year, I think we'll see a new and improved report that will include new programs and hopefully have some revisions that I think will be really meaningful. That's all I have.
Thank you.
Yeah.
I think one thing that would be helpful for me for analyzing the data too, as you're looking at your long-term goals, if you guys can set up a tolerance band on performance metrics for a shorter time, so suicide prevention is what came to mind.
Mm-hmm.
If you can see to get your long-term goal, let's say it's a 10-year goal and we're at year 2, seeing a band of we need to be within this range as it goes through time to still hit those goals based on performance metrics, that's super helpful in being able to track long-term applications at a
To
short-term
put it
time
into
frame.
perspective,
And put it
yeah.
in perspective, so you can
Mhm.
say, yeah, we're right on goal for suicide prevention on a 10-year plan. Or you could look at the
Right.
data and say, at year 2, it's really easy to lie to yourself. I've experienced this a lot.
Yeah.
Where it's like, oh, we're right on track, and then you actually look at a regression line analysis or whatever at year 10, and you're like, we're not gonna
We're
hit
so
any
not on
goals.
track, yeah.
Yeah, and so
Mhm.
having that up front, I've found really helps people who have to do a long-term project look at ways to be successful on a short-term level. So that kind of data will be super useful, I
Yeah,
think,
that's
especially
really
for me to look at.
helpful. Okay,
Cool.
great. Any other questions?
I think we have that concept, the line of sight concept.
The line
that
of
you start. I will admit up front though, that there either doesn't exist or I don't know of its existence. Some of the data that would actually, we try to find it, that would actually make all those connections. I think that's a challenge.
Totally.
It's not one we should avoid, but I
Right.
think it's a challenge in what you're describing.
Like financial forecasting, it's guessing
Mhm.
plus math, as Dilbert would say.
Yeah.
So, I mean, you just have to create your metrics and see if they work, so it's kind of a test. It's a hypothesis testing, right? You set up metrics and say, okay, we think this will let us get our data that we
Mhm.
need, and then
So
you'll
we
know
just
at year
revise it.
5 if it's working or not.
So we did 5 years of such and such, and
Exactly.
something over here didn't change.
It really helps, especially like junior staff in situations, to see how they're making an impact on a long-term goal.
Absolutely.
So,
Yeah.
they use it as morale improving techniques too, so.
I feel like we could use more coaching on that.
Absolutely, definitely. Very open to that.
Excellent.
Thanks. Okay.
Sorry, I have one more question. About the addition of new measures, so, and I don't want to go through them in great detail and nitpick, but I just have a question about sort of the process for adding new measures, and is that very much sort of that department or that division or that program kind of sits around a table and says, well, what do we want to measure, or is there any sort of a national
Strategy.
database structure? I mean, in healthcare, this is very well defined, and you go
No,
look
that
at, we're
isn't.
measuring the quality of our diabetes care, and they're national validated
No.
measures
Oh,
of numerators and
we don't
denominators, and we
have
can
that.
pick from that menu. Does anything like that exist, or are we kind of making these up program by program based on what we think we can measure and what we think
You know,
is important?
some of it is really just, you know, a lot of these programs already have to track data for the state. And so they might actually use a measure that they're already tracking to incorporate here. A lot of times too, we encourage staff to pick something that's really useful to their program. And one thing we want them to keep in mind is if someone were to ask you, tell me about your program, these measures should probably give individuals a pretty good idea of what you do or what's happening. And, you know, in creating the new measures, we have a combination of that. I mean, it's really just, you know, like I pulled up Eat Smart, which is a new program that has initiated new measures. One of them is decreased percentage of Missoula high school students who had reported no fruit or vegetable intake. That's already tracked, the YRBS. But we also have indirect and our, you know, a lot of the process measures that we're doing, a lot of the activities that we're doing impact this measure. So we try to encourage staff to choose a diversity of measures.
But there is, in comparison to what you described clinically,
That's not
there's
something
no
that's linked to accreditation where you can go up and pull up, here are the standardized
Oh,
measures for
oh,
health
the
departments.
standardized. No,
Here's the
it
best
is
way to
right.
measure the success of your
It is
home
a
visiting
world-
program
it is a
and
world
compare yourself
removed.
to health departments across the country as to how you're doing.
we might
We're not
have
there
that
yet.
for,
Organizations or
we do have that for individual evidence-based programs. But we have to show that fidelity to that model, and that's not necessarily what we're doing here. This is much more organically grown.
The beauty of this, though, is you can build your own best practices.
Mhm.
Yeah.
So as you do it, it creates opportunities to go after grants, go after whatever, interface with nonprofits, do all that kind of stuff,
Totally.
to be able to create kind of that best practice use, which then can be used to influence the rest of the health departments around the country.
Definitely. And a lot of staff actually tell me that, oh, I have to report on this data for the state, but it's not really exactly what I want to know right here. It's not what I want to know in Missoula County. I want to kind of change this a little bit. This is an opportunity for them to do that, to measure something that's more relevant specifically to what we
Yeah.
do here. So,
Yeah, it's new to us, and it's unfortunately very new to public health. But we do inform ourselves by what's going on in, you know, in the nation with accredited health departments and others. I think one of the more difficult aspects, though, is we're trying to grow, kind of goes back to your point, we're trying to grow from process objectives here and long-term outcomes here, and where in the heck do they connect and how do we, but it doesn't have, like, you know, you have the ICD-10s, you have all these certain, already measured and paid for by certain ways, kind of very delineated activities. Ours are not, except for the evidence-based programs.
Well, then you even go further than that and start to look at how they correlate to each other.
Yeah, and sometimes what we do, like you were talking about animal control, sometimes what we're doing is so basic, we're trying to find our denominator.
Totally.
So one of the reasons the animal control licensing measure is still a raw number, oh, we got 10,000 more licenses, that's
I was gonna
great.
say they're-
What is our denominator for how many dogs are out there?
Yeah,
Well,
but you have 30,000 more dogs,
we
so.
keep looking
Yeah.
for that.
Right.
So some of what we're doing is really kind of, we're trying to evolve in the way you've described. I don't think we're even trying to get to where you've described overall. But sometimes we're just trying to find the data so that we can make that initial assessment and improve the measure that way.
So how many accredited health departments are there in the United States?
There's a lot now. We were number 33 or 34, but there's thousands now.
And does the accrediting body keep statistics on your outcomes
Oh, yeah.
and things like that?
Yeah, they
So-
do a lot of, they actually
Gauge
have a
one.
very comprehensive and I think sophisticated feedback system for all of their activities related to accreditation. Do they keep statistics on the actual health outcomes as opposed to the process and the strength of the accredited department? No. That's where you turn to the already established Healthy People 2020 and those types of pieces of guidance. So that's another thing, how do you connect that
To this.
to the infrastructure?
I'm gonna ask a sandpaper question, because it sounds like accreditation's expensive. And I do
Yes.
lots of stuff for other accreditation, so I know it's expensive. What's the real benefit of the accreditation to the health department?
I think the benefit that we've seen is the, not just the advent of quality improvement, because we've tried it over the years. It's the culture
Okay, cool.
of quality improvement.
About applying for grants. If you're accredited, it increases your
Yeah, that's not
acceptance.
paying off in a big way, but in a couple grants, it is.
That was my understanding when we were going for accreditation, that it was going to open the door for the opportunity for more.
We've had two
more
specific
grants.
examples where that was the case.
It also helps us to not have to put, sorry to interrupt, to
No,
not have to
please,
put.
you're the leader on that. You must
So
have it.
it helps us to not have to put as much work into applying for the grant. So whilst we haven't had a lot of opportunity of only accredited health departments can apply for this grant, we have had a few grants that we've applied for where it's like, okay, if you're an accredited health department and you want to apply for this grant from the CDC, you can skip to page 60 of the grant application and not have to go through that whole first 2/3 of it.
Yeah.
And that has been super helpful when looking for funding.
You know, I think of public health as kind of the community's immune system. You probably heard me say it 1,000 times. And, you know, we're not the only part of the whole organism, or even the immune system. But I think accreditation really looks at the strength of the immune system. Is it really functioning? Is it really healthy? Is it vigilant? Is it reaching out and getting information from the rest of the organism? And is it then improving and recognizing previous threats and putting barriers or practices or policies in place so that you prevent that threat? And that should be the connection to the rest of, you know, the community. And I think it really does strengthen that, if you can think of it in that fashion, that immune system. There's things that, you know, when you go through it, you think, oh, engagement with the community. Geez, you know, this is Missoula, there's 18 subcommittees, we're totally engaged with the community, and it's like, well, you know, that'll get you so far, but did you really talk to and did you find the data for folks who are truly experiencing health inequities and disparities? Well, you know, we talk about it, we're well intended, but did we really get there? And did we really hear from them? And did we really measure? Those types of things, I think it keeps pushing you forward. And it made me write a bunch of policies. I've always been policy averse. But
And another plug on that, just because Robin does such a great job. We actually just submitted an article for the Public Health Accreditation Board for them to put on their website because they requested via email accreditation works stories. And that was one of the things that we wrote about, was that we essentially have now, we thought we were engaging with our public and we thought we were engaging with our target audiences, but we found that what we were really doing prior to accreditation was we were engaging with the organizations that served those people. And so now we've got different focus groups, surveys, a variety of different ways that we actually reach out to the public, and that's what the article is that Robin wrote. So it'll be published sometime, I think, in the next month on the website. So, yeah.
The question, oh,
Go ahead. No,
so the question I'll probably ask in the future at some point is, name the 3 things accreditation gave us that we wouldn't have got without accreditation. That's kind of the way I like to form questions or ask in the future. And at some point, I probably will ask that question of, okay, what are the 3 or 5 or 10 things that accreditation gave us that we would not have before? Because that's how I can frame in my own mindset, why it's important.
yeah, and it causes us to find the words. Basically, frankly, Cindy was the leader and I was the convert.
Well, and I presume that there's
So-
also some intangibles, just that, how do you define credibility and how do you measure a person or a group that you're talking to perceiving your credibility, be it, I'm thinking of things like in the legislature and thinking of things like with the state and things like that. What kind of credibility does this body bring when they testify at the legislature on a bill, when they're talking with the state of Montana about various things? And we get into every now and then disputes with DEQ and agencies like that. We even sue them sometimes when we think we need to. And credibility matters, and sometimes that's it's a hard metrics to measure sometimes, but it still matters.
In the 12th domain, the 12 domains, is our governance. And in this community, we've always had strong governance, with the engagement of this board and the expertise of the board. But even there, we found some things that, weren't going from the board to other members of the staff. And if you look at some of the surveys, like some of the research I've been involved in, on what exists in different localities, there's huge gaping holes in a number of areas, and unfortunately, one of those is the governance. Not even having meetings and things like that. So.
Well, kind of like what you were alluding to at the outset of this discussion, Alan, is the self-evaluation that was kind of required in accreditation. I remember that as being, so how do you measure and define how much of an improvement there is in the whole function of the health department now and the Board of Health now, having gone through accreditation and having been the benefit of that self-evaluation that otherwise you wouldn't have gone through. Some of those things are hard to measure.
But it is amazing for someone that works in any other arena that public health is so late in coming up with the standards and the ability to be accredited.
Yeah.
I think people would have assumed it was there. It wasn't.
It was my recollection of when we went through the process, it was just a real structured way of holding oneself accountable. Because you had to ask, everybody, the health department had to ask itself hard questions.
Yeah, we did.
In a structured way, and then deal with those. And it just sure seemed like there was a lot of benefit that came out of that kind of self-reflection and accountability thing.
I look at doing it so late in my life and late in my career, and to say that it truly converted me. I think, you could use me as the case control. It did. I mean, by the time you really, really do it, love it or hate it, things have changed, and that's good. So. So thanks, that's a great question to ask. Mr.
Yeah.
Herman.
Well, and one direct effect of accreditation is our performance management and performance measurement system, because while everyone had things that they had to report as far as data, we didn't really have a centralized place or a way of actually having programs process what they should be measuring. And so that was a direct effect of accreditation.
But you're right, we spent a lot of money.
Well, my dream is to really boil all of it down to a calculation so you can do an ROI. $1 into public health equals this, and the more data we have, the more that can go through. And then it's an easier sell, whether it's a grant-based sell, a taxpayer-based sell. It all becomes easier if you can just be like, we're tracking everything now, and $1 in equals $7 out, and it's always a good investment. Now let's move forward.
Well, and that's what's happening now with the
Yeah.
cuts, is that's exactly what we're having to quantify and testify
Nobody will
to.
listen to our ROI.
Right.
I'm used to
But-
zero-based budgeting, which means you get no budget and you have to beg for everything.
Yeah,
So I come
yeah.
from a different viewpoint.
There's definitely a lot of areas where we have return on investment data. I don't think we have it in a way that it yet relates to actually an accredited department or jurisdiction versus a non-accredited. But we have it in different areas of the kind of the A to Z types of programs that we are involved in.
I think FAB has a think tank for that
Yeah,
right
they
now.
do.
They have people looking at that.
You could join that.
Yeah.
Well, the more data we can collect, the easier. It doesn't even have to be us pulling it out. We can eventually find that to be an internship, someone doing machine learning. It really doesn't matter. We can eventually find the right resources, either as a case study or whatever, for somebody to help us extract that data, but we have to gather the data to even be able to extract it. Sorry, I didn't mean to.
No,
No,
that's
that's,
fine.
you've done a lot of listening, it's good to hear.
Yeah. So with that, since this is an action item, we'd be looking for a motion to accept the performance management report.
I do a motion to accept the performance management report.
All right, any public comments on the motion on the floor? Give it that Ellen pause. None? All right. So, all in favor, say aye.
Aye.
So moved. Then, public comments on items not on the agenda. Any public comments out there on any other item or any other subject? All right, seeing none, any board or staff comments on items not on the agenda? All right, seeing none, we will adjourn as the Board of Health and convene as the Water Quality District Board. And, let's see, do we have the January minutes?
Actually, yes, the minutes were sent out to you
They were sent via mail.
Oh, yeah.
previously. A short
Yep,
two-page
yep,
set.
yep. That wasn't here. so.
So I'd move we approve or accept our January minutes.
All right, any public comments on the motion on the floor? Seeing none, any board or staff comments or discussion on the motion? All in favor, say aye.
Aye.
So moved. All right, then item 2 is Water Quality Advisory Council update. I guess the last Water Quality Advisory Council meeting was canceled, but there was a public meeting held by EPA on Smurfit
Do we,
Stone. I don't know if
do we have
it's-
staff?
And we did check with Peter and with Travis, and they don't have anything for you today, so they'll report next at your March meeting.
I
So-
could forward to you, if you're interested, in it, unfortunately, because of their absence right at the moment, I could forward to you a summary that Peter sent to the commissioners because the newspaper called for
Right.
a story, and he was at the Smurfit Stone meeting.
I was there too.
Okay, and you were there.
The one interesting thing I will say, and we were all taken a little bit aback in the meeting, was that on Thursday, and Anna can probably speak to this, Thursday of last week, the current, and I don't know if they're owner of record yet, they're getting Wakefield deed restricted the property so no residential wells could be drilled on it. So that changes the picture. We don't know what's gonna happen now.
And I think it was, Wakefield didn't file it, it was M2 Green that filed it, which is the current owner of record. And it was technically filed by the attorney for
West Rock.
Yeah, West Rock.
Right.
Which was involved in the initial 2011 sale between Smurfit, MLR, and M2 Green. And so Wakefield had no part in the filing of this deed restriction on the face of the documents.
Okay, she might have gotten that.
Yeah.
The EPA rep might have gotten that wrong, but so everybody in the room just kind of went.
Well, it'll be interesting to see.
They still have to clean it up to residential standards.
Well, it'll be interesting to see how the various parties, including this board, comments and looks at that. And we had a deed restriction issue on White Pine and Sash, and there were some parties that wanted it to be recognized by, in this case, DEQ, and DEQ refused to. That's not part of our process. We don't recognize it. So
and Wakefield is obligated contractually with the county to foreclose on that property to initiate foreclosure by March 1st. And I assume that the validity of that deed restriction will be dealt with in that foreclosure proceeding, because I actually don't think that Wakefield is a part of that restriction. And obviously, as the party that's going to be owning the land, it's not necessarily going to be in their interest to have that kind of restriction. So
yeah,
I don't think we've seen the end of it, and I don't think that it's a done deal that it's enforceable.
Look, we've seen this approach used before, and not have it carry weight through the end of the process.
Is Wakefield the mortgager, or is they're the direct mortgager?
Yes.
Okay.
Yeah.
And they're unaware of this?
As far as I know.
Interesting.
They're reading it in their daily Missoula.
Exactly.
Nobody in that room was aware. Everybody was kind of like.
I had, my wife heard me in the next room this morning when I read that in the paper.
Yeah, it was.
It wasn't, language that should stay
People were
inside
very
the house.
excited to hear that. They're like, oh, fantastic. That means, they're going to leave it alone now. And then the EPA rep was kind of like, they still have to clean it up to residential standards. We don't, that's all we know.
Even with a whole new set of players, including at DEQ, somewhere in our records, we have records of various public discussions about what deed restrictions, valid or not, which is another question, what they mean for cleanup decisions. So if we get a different opinion, we might have to dig up some records.
Interesting. Well, I guess that probably takes care of item number 2, the Water Quality Advisory Council. That's what we were going to talk about with Smurf and Stone. So that takes us to 3, public comments on items not on the agenda. Any board or staff comments or discussions on items not on the agenda? All right, seeing none, we'll adjourn as the Water Quality District Board and convene as the Air Pollution Control Board. We don't have the January minutes, so we'll move on to item number 1, which is action to appoint Air Pollution Control Board liaison to the Air Quality Advisory Council.
So Karen had done that in the past, and again, this perhaps shouldn't have been an action, but I did let it go forward that way. That is, with his leaving, that role is open, and for anyone who's interested in being that liaison, those meetings are once a month. Which Tuesday? The first Tuesday. Sarah staffs those. You don't have to attend at all times, but there's been generally good attendance when Garen was in town. So that is a role for a board member to consider or to volunteer to take at this time, anytime.
I'll consider taking that role, but I'm not going to confirm right now.
I know, because you took the other one last month, and I recognize that. That's why I wasn't glaring at you.
And as Ellen alluded to, what we have it listed as an action item.
That happens about once every 8 years. It means nothing.
And the bat phone?
It's
It's
not-
like, it's a bright red phone that's
It's not
ringing.
red,
That's
right?
usually bad.
It's not that- Yeah, it's-
Well, it's listed as an act.
It's a wrong number.
It's an antique over there. I didn't know that was a working phone.
Doesn't have a rotary dial. It's got push
It's a
buttons.
princess phone.
Pretty fancy.
It's gotta be at least
Utilize that.
1950s or earlier.
I watched a teenager trying to do a rotary dial, and they were actually doing math. This is 7 and this is 10, then I have to go, then I'm going, oh my God. So,
Anyways, well, it's listed as an action item. If you read our bylaws, it's not really required to be an action item. It's actually just not required to be an action item. But we've kind of done it that way as a good heads up to the board, so the board's all in agreement that whoever is acting as a liaison is indeed acting as a liaison. So it's, so we don't need to act on it today, actually. It's more of a heads up, more of a kind of thing. So anyways, appreciate you considering it, and we don't have to nail that down
Nope.
at this point.
please
What's,
consider.
what time are the meetings?
6:30.
Right here.
6:30, the first Tuesday of the month, and yeah, it meets
Here.
So, and Ellen, are you gonna talk about the fire?
If you want to mention, I'll start
Why
on that.
don't you start
We
on?
were staff, air quality staff, myself, and Ross as the chairman of the board. I think you got an update on this, but 2 of you weren't members yet. So for 2 of you, this should be a little reminder. There's a group that's formed to look at prescribed burning. There's several groups already out there. There's the forest, there's the smoke. But with the idea of what are we doing, what should we be doing, what can we do related to prescribed burning? And they recognized that with climate change and of course last year's fires, that there's a lot of material, some of which is not completely settled, about how prescribed burning and what types can affect forest health and in fact unplanned burns, wildfires. They brought this department in because they also recognize that smoke, whether it's from a prescribed burn or a wildfire, is an issue for public health, and it's certainly an issue in this airshed. So the group kind of has a name, it doesn't have a name yet, but it's the Prescribed Burn Group. And we were involved a couple months ago with a very large meeting where we had presentations from all concerned, and Forest Service, other conservation, landowners, burners, chairman of the Air Pollution Control Board, the county commissioners, university scientists. And then they've started to form a core group. And I've suggested, and Ross has agreed, that he will serve on that core group until we have some product, whether it's a resolution or presentation or some sort of product. Will keep the board more directly informed as this proceeds.
Yeah, I find it's a real fascinating problem, really. I mean, it's a lot of tension between, the huge catastrophic fires like we had in Sealy Lake last year, and even here in Lolo. But I just mentioned Sealy because the air quality went so off the charts at Sealy Lake, and it was such a health issue. We don't even really know what degree of health issue it was yet, because it was so off the charts. We don't have any data to compare it to. My understanding is off the charts planet-wide. The worst air quality ever measured is in Beijing, and this was worse. So what do you do with that in terms of assessing
We have
health?
one stage of a health study and then another one that we think has been funded by the university, but we don't have the results.
So yeah, so just the tension of trying to mitigate for those kinds of catastrophic smoke events. I'll call them smoke events because that's what we're really talking about here. To kind of try to mitigate those catastrophic smoke events, and probably one of the big tools to mitigate that is smaller, more controlled smoke events that also have health issues. So it's a kind of a purposeful smoke event that you know is gonna have some health issues to try to avoid the huge catastrophic events that have huge health issues. And there's a lot of tension in that, and it's complicated, but I think it's incredibly important for this community to work with. And with the fire lab here and whatnot, we've got some tremendous,
Fire lab, yeah, I forgot
we've
to
got
mention.
some tremendous resources. I mean, basically, a lot of the national scientists that work on that are here in Missoula, which is pretty fortunate. So anyways, those discussions are going on, and there's this group that's been formed to discuss that, look at those issues. So
We're pretty much at just the sharing data stage. I mean, Sarah already works with all these folks, but they're adding to the group, and they're, adding that focal point to try to, what can we do that's both preventive of wildfire burns to some extent, and preventive for public health and smoke exposure.
If I can kind of preload some questions, Sarah's coming next week, I believe. Or is it 2 weeks to come talk to council?
So, in next week, I think I'll only be talking about Rule 4.112 because you guys are going to be missing a lot of council members. So I think I'll be coming back to City Council of PSNH community on the 28th to talk about what 2017 was like and what happened. And then in a future meeting, we've been asked to come back and talk about policies for protecting public health during a smoke event. But I can certainly speak to what happened this year, why the fires were as bad as it was, why the smoke was as bad as it was. And anytime you guys want to know about how smoke decisions get made, because we are the portal for all approvals of every single prescribed burn comes through my office. And I can certainly speak to how those decisions get made. If anyone ever has any curiosity about smoke management, I can talk about that.
I think we should schedule when the agenda allows that. We've got budget and some other issues coming up related to the Medicaid rule change. We should probably schedule for the board, if you're interested, presentations similar to the one that you did at the large group meeting for prescribed burns. So you can understand how large that network and that system is. It's very sophisticated.
Well, I just know there's going to be questions from council because budget will be coming up. Policy-wise, should we provide safe spaces? Is that something we should put in the budget and fund? What does that look like? What does it cost? I just want you to kind of be prepared because, of course, we ask a million wacky questions outside the subject, right? And then expect you to just come up with answers. So it's probably going to come up.
And we also have going on a contract with Climate Smart Missoula to work with Sarah to do what Sarah's referred to, I think, as a blueprint. It's a plan. You've provided sort of an outline for the plan to capture what we rolled out kind of organically last summer and make it easier to deploy that, but then to look further down the road for for the next time, but for public spaces, safe spaces, getting air filters to who needs them and how to promote them for people who could buy them with their own means. And so we'll come back on that as well. And also, I could send you probably a link. I don't know if I can send it. I think I can. There was a presentation by a gentleman from the fire lab. I can't think of his name. The one about the
Mark Finney.
Excuse me?
Mark Finney?
Yeah, Mr. Finney's presentation on historical fire in the forest, historical wildfire, and our current conditions. And he gave a lengthier presentation for us. He could probably go on for days, but he gave, at the commissioner's request last week, a 20-minute presentation at their public hearing, just so we can all start to understand not only what the other groups are doing, but what their goals are and what their barriers and their opportunities are, so we can figure out how to work together. We've done a lot of work, successful work in not getting polarized. It'd be a really easy issue to polarize on.
there's a lot of tension.
Yeah, no, you
Just in the
can't burn,
issues.
we're gonna, you can have a wildfire that doesn't violate the EPA standards because it was a wildfire. But you could have a prescribed burn or just burning of a,
Yeah.
you know, that will violate, even if it's less smoke. So
Yeah.
how do you do that?
The one piece of public health data I'd be interested in too is the impact of sustained low-dose smoke versus a cataclysmic event that's a short period of time. I know Sealy Lake was an anomaly because it's a chimney up there and it all just dumped into it. But when you're looking at that, you know, what is the long-term impact of continuous prescribed burning to control it versus a single isolated event? I'd be interested in seeing if there's any data
Yeah.
on what the health impact is of that.
We've done a lot of literature searching for that particular question. There's a lot of literature, but not on that particular question.
So my understanding is that group meets again on February 28th,
Yeah.
is that right?
Yeah.
And I won't be able to go to that meeting because I'll be out of town. I won't be in Nicaragua or
It's more fun.
any place like that. I'll be all the way in Spokane. But anyways, so the health department has a seat at that table.
Right, and
The
I'm
city-
trying to work you into the listserv so that you get all that information.
Yeah, but anyways, that's the next.
It's a little
meeting.
ad hoc still, so I don't have the listserv gel.
That's the next meeting of that group. So are the county commissioners, do they have a seat at that table?
The county commissioners themselves aren't showing up at the core group. We're charged with trying to figure out what it is we think we're trying to do, and then I'm gonna say, using my own words, finding the words for that. Finding the words for it, because, not just the ways, and they're looking at breaking into work groups, so there'll be a science and technology work group, so that the burners that Sarah normally works with, they'll actually be doing more work and thinking up front. You know, where are there niches for burning, or where are there niches where there's burning that was approved but couldn't happen logistically, and those types of things. And then there's another work group, and for the life of me, I can't think of the name of it. So that's how we'll start forming.
Okay. So I guess all that's just kind of a heads up to this board that that's something that's going on. in
As
this
soon as we
community.
have anything cogent, even cogent, a question, we will start exposing you to it.
Okay. So then on item number 2 on the agenda, air quality, I didn't mean to cut that conversation short, is there, but if we're all ready, we'll move on to item number 2, air quality advisory council update with Sarah.
All right, thanks. For new folks, I'm Sarah Cofield, Air Quality Specialist with the Air Program here. Here to give the update on our advisory council meeting that we had the first week of February. We had 3 folks up for renewal, and the council voted to renew their memberships. That was John Ottman, who's an alternate. He's a forester. Ronnie Flannery, who is an attorney with the American Lung Association. She's a regular member. And Rachel Burmeister, our student representative. All of their terms, the council did vote to renew them, so I'll get those appointments out to them. At the same time, we had a vacancy announcement. Martin Twir is moving to California, so that will open up a vacancy on the council that technically, traditionally, the alternates will get a first stab at. And then following that, I will announce whichever vacancy we have, either a full membership or an alternate spot, but that is going to be coming up soon. So that was some housekeeping that we did. Our main discussion item was Sealy Lake for wood stoves, because while Sealy Lake did have the worst wildfire smoke episode we know of in anywhere ever, they also have typically the worst winter air quality in the state. They're having a fantastic year this year, but it's really weather related. I've been having lots of fun playing with weather data and comparing this year to last year, and it's very dramatic how mild this winter is compared to last year. But typically they do have tremendously bad winter air quality. We have done a wood stove change out and replaced over 170 stoves, but we have learned the hard way you cannot solve a wood stove problem with more wood stoves. And so the question is then bigger ideas. With the sewer going into Sealy, that presents opportunities and challenges, because the challenge is the risk of higher density housing And in Seeley Lake, currently there's no natural gas, and so the most affordable way to heat your home is a wood stove. And if we have the chance of higher density people, that means a higher density of wood stoves, which means continuing poor winter air quality. And so, but with sewer going in, that is an opportunity for the big pie in the sky, big idea of if there was a central boiler for Seeley Lake, say at Pyramid, who needs a new boiler, they just really do desperately need a new boiler, that could service the most densely populated neighborhood, that would be a way of replacing those hundreds of individual wood stoves with a central boiler with super good pollution control on it. It would still be wood-based heat, but it would be centralized, and that would be a way to take care of it. And when you're having lines dug for sewer, you could lay in the piping for the boiler. It's a really big idea. It's a very expensive idea, and it's one that require a lot of buy-in from the community and obviously Pyramid. But it's a good thing to talk about and think about. This idea, it fixed a similar problem in Alaska, where there's a community that had too many wood stoves, they're smoked out, put in a central boiler. It's still wood heat, but if they were no longer out of compliance with the NACs. But it is a many, many millions of dollars idea, and the timeline is short. But we wanted to bring it to the council and just kind of get some of their input and some of their ideas. A lot of them have connections in Seeley Lake. John Ottman is well connected to Pyramid Mountain Lumber. We have on our council Dave Atkins, who is really involved in using biomass for energy and heat, and he knows how people have funded things like this in the past. So they are going out to gather information, and hopefully we'll be reporting back next month from what they know. Just try to see if we can get that ball rolling. It is too big of an idea to be housed in a 2-person air program. Ben and I we cannot pull something like this off on our own. So
It sounds like what DNRC and the Biomass Energy Program does. Have you tried to pull them in to help for assistance from there, or?
well, this is still in the very beginning phases.
That
So
sounds like something they would manage.
yeah,
actually.
yeah. So I think that sounds kind of similar to the Fuels for Schools.
Yeah.
The thing that went through, and that was pretty successful in some areas where they built them correctly. In one place they smoked out a playground. So no, they're all community created equal. But yeah, no, exactly. Like there's so many players that need to be involved.
And that used to
in
be
this.
Julie Keys at DNRC, but I think she's at Forest Service now, so I don't know who's doing Fields for Schools now, but.
Yeah, so there's people to talk to and get engaged with. It's a big idea, but since the sewer is, unless the sewer board gets dismantled, the sewer's going forward, and that provides us an opportunity of saving some money on the cost by having the sewer dug up. So we talked about that, and it's a big idea. It's a pie in the sky idea, but
At the very least, if we fix it, would not be good for a whole bunch of development to be made with fireplaces and stoves right up front.
it would be not.
Timing is very critical there.
Yeah.
So at the centralized boiler, would the heat be distributed via piped hot water?
It would be a radiator system. And Pyramid is due for a new boiler, but part of the reasons they haven't purchased new boilers is because it's extremely expensive, and they'd have to have much more pollution control equipment than they do now, because boiler standards have been through a lot since last time they upgraded their boiler. So if there was a way to have funding to help pay for it, they may be interested. But we need to get them on the table. It would require a lot of community buy-in, and there's folks that are already unhappy about the sewer in the first place. So how excited would they be about this?
Gigantic grant.
Yeah, so, but right now, unless you change the fuel or get rid of the wood stoves entirely, there's not a clear path forward for Seeley Lake. Ben has been running a small pilot program up there where we provided some folks with manufactured wood for the winter to see how that helped their emissions, and it was amazing. They put those in and they had super clean emissions, but it's an expensive way to heat your home. So that would be the other pie in the sky, would be a way to centralize the creation of those manufactured logs in Seeley Lake, using Seeley Lake's wood and then getting people to burn those.
Is that because in part, the moisture contact is controlled in the
Yeah,
manufacturer?
they're
like with
incredibly,
pellets?
they're incredibly low moisture and
Yeah.
can't store them in the elements because they'll just disintegrate. And so you have a controlled fuel source. They're basically a
You
big
can't burn
pellet.
them wrong.
They're basically a big pellet. And the folks that use them, some of them, we heard back, Ben can obviously tell you more about this, but there's a guy who just loved it because it was clean, there was hardly any ash, and it was great. Another guy who didn't like it because it burned too hot, so he had to throw in his wet wood with it to
Open all those
cool it down.
windows.
And then there's the guy who would throw 7 into his fireplace at a time and was sad as he ran out
Really
before the
hot.
winter was over. So, yeah, different experience. But from going and looking, even with the gentleman who mixed his fuels, Ben would go and look at the emissions. It was a tremendous improvement. So fixing the fuels, by having them burn super large pellets or boiler system, but just the wood stove change-out was not sufficient for
And we knew it wouldn't be.
And we knew it wouldn't.
And that was before the sewer became in the equation, so behind the 8 ball a bit.
So, oh, go ahead, sorry.
I was gonna say, would that, I mean, that is a community benefit improvement project. Would that be eligible for any of the CDBG or community reinvestment funds that the Montana Department or the MCDC, I never know the acronym, with Dave Glazier over there? Projects have to at least be 4 million.
CDBG,
They have to
yeah.
be
I don't
$4
know
million.
enough
They
about-
just were awarded yesterday. They have to be at least $4 million.
It would definitely be more than $4 million.
We can meet that criteria.
Yeah, my understanding is that water mains and water connections are expensive.
Might be worth a phone
Everything's
call.
expensive.
A little bit.
Exactly, help it.
I mean, because it would be a community-wide system.
Yeah.
It's not just individual.
Yeah, and I think that's very, I think, yeah, I want to add that to our list of things to.
I don't know.
look into.
I know there's income requirements on CDBG generally. but-
So I think there's a huge advantage. So,
Community reinvestment.
well, DNRC hosts the Montana Wood Products Retention Roundtable. And so Gordy Sanders from Pyramid Lumber is the chair of that. There's all this stuff. They talk about this stuff all the time, more from bioenergy and how to make wood products more valuable and whatever. But like DNRC and the state forester, I don't know if there's a state forester now, they were shaking stuff up, so. But they have a meeting, and I think it's the first or second Tuesday or Friday of every month. I think we just missed the last one. But this would be a good one to try to get that group involved in, because like Julia Ultimus from she's like the Foresters Association, all that kind of stuff. They're always looking at how to make wood valuable in Montana again because of Smurfit Stone going away. And so it was formed right when Smurfit Stone closed down. And so they're always looking at this kind of stuff, and they know all the grants, and the USDA is always there, and Senator Tester and Senator Daines and usually Congressman Reberg's representatives are all there. So there's usually enough people at that specific meeting that getting attention for this or getting that input and getting them interfaced on a community project like this could probably happen. I'm probably out of state at the next meeting, or out of country most likely, looking at my schedule. But I do not know that meeting exists, so I could probably tie whoever you want to be point to at least start the conversation. I can at least get that introduction going and get something going where that could go. I haven't attended in a couple months, but I know it
What's their
exists.
name? The wood what?
It's the Montana Wood Products Retention Roundtable.
Okay.
There's so many alphabet soup things that occur that.
Yeah. I mean, it sounds like a good.
This is right
connection.
up their alley,
For-
so
for
like,
whatever-
because the
whatever
Forest
remedy.
Service is there, all those people are usually at this meeting, they have a representation, so
For
I'll
whatever
connect
remedy.
you. If you give me your card, or I'll give you my card, I'll connect you, and we can at least organize that and get it so a representative can go over there, or they can send a representative to talk to you guys and go from there.
That sounds great, yeah. We also need to get the community on board.
No, I just meant, yeah, it starts that process from the federal and state and, mill access from it, because I know, because like Pyramid chairs the board, so we should go from
That's
there.
awesome. I did not know they existed.
A lot of people don't, apparently.
Thank you.
Local Wood is Good is their big thing they did, so if you've ever seen that program, that's the big thing they did for that.
Local, very dry wood.
There's a ton of felled wood, yeah.
Very dry.
I think it'd be worth reaching out to MCDC as well and seeing if
Yeah.
potentially then we could get.
Community reinvestment funds.
But I think they can even help with like alternative ideas, and they do technology discussions, and all sorts of stuff gets presented while they do those meetings, so.
That sounds excellent, thank you.
All right, well, with that, I guess we'll move on to public comments on items not on the agenda. Any public issues for discussion? Then board or staff comments.
I have one comment from last time. So we were talking about dust mitigation and that whole aspect. So I did a bunch of research on alternative strategies for dust mitigation besides magnesium chloride. It's really expensive. So the reason no one does it is because anything besides magnesium chloride is like 10 times more expensive from what I can tell. So from that aspect, most of the stuff I read up on magnesium chloride and all the health implications and whatever, there's two major concerns. One's a watershed concern for magnesium chloride because you get salt in the water. So that would be runoff and analysis, and I don't know whatever you guys do for that aspect. And then the other one, and I guess it's more an aesthetics concern, like I mentioned on the call before, but I was in London, so I don't know if you guys heard me from that aspect. But most of the damage that's done to plants along roadsides is it's just literally like pouring salt on a slug. It's not that it's toxic like people think and it's killing the trees. It's just causing salt issues with the tree, and so it kills the plant from that aspect or hurts the tree or whatever. And most of the literature out there says plant salt-tolerant trees or don't plant trees that close to the road. So there are some things that can be done, but if we want to pursue effectively asking the county to continue their dust mitigation policy, the magnesium chloride is probably the most effective and environmentally friendly pathway I could find that hits the fact that they had budget constraints, which is why they stopped before.
Right.
Anything else we propose is going to be significantly more expensive.
The Water Quality Board actually has to approve whatever de-icer is used in the water quality district, just so for your information.
And I think they've already approved the
They
magnesium
have.
chloride.
They
so.
have, but for new members' information, that does fall under your bailiwick. There's one of the beliefs that you may or may not have heard over the speakerphone is the corrosive aspects of mag chloride. Some people remain concerned about
It
that.
absorbs moisture out of the atmosphere to create the dust from forming. So if you have mag chloride in your car, it's going to suck moisture out of the atmosphere. Water and metal equals corrosion generally. So yes, it will corrode things. So I just wanted to give an
I
update because I
appreciate
looked
that,
into all the
yeah,
different, I
yeah.
went through like hundreds of different companies and all their different products they produced and cross-analyzed it and pulled out all the stuff you could buy globally and all that kind of stuff.
I
And
think
mag
we'll
chloride's still
wanna
the cheapest.
point out to Jean, who couldn't be here today, because that was her question, that we have minutes on that.
Overachiever.
And I have access to a big database
I
that can be
know.
like corrosion inhibition and all that, and just enter it, and just pull down all the pricing, so it's all expensive.
I go back to
awesome.
when we used recycled oil, so it's all better as far as I'm concerned, getting rid of that.
This reminds me of 10 years of Water Quality Advisory Council meetings with Alan English.
Uh-huh, and why it's really not a good idea to put recycled oil on the road.
Lived and breathed de-icer for a decade.
Waste oil, I don't even think we called it recycled.
In other countries, they have a whole process to harden the roads with like sugar and enzymes and stuff that's
Really?
pretty cost effective too, but I bet you it does not have EPA approval, so it could not be
Oh.
used. It's used to, like in Brazil and stuff to harden up mud roads
With
during the
sugar?
rainy season, yeah.
That's amazing. We've got a lot of corn syrup around. We really need to remove it from the diet stream.
That's not GMO free, and I'm sure we need a GMO free road, so.
We've got the glycogen startup company that just went defunct in Missoula. River Top. And that was one, dust abatement and de-icers was one of the products that they were looking at.
Glucaric acid.
And
Exactly,
detergent.
Glucaric acid. So, anyways, other board or staff comments and items not on the agenda?
This was a very entertaining meeting.
Yeah. Well, seeing none, we'll adjourn as the Air Pollution Control Board, which then has us adjourning as all three boards. So the meeting is done.
Thank you. Thank you.
Thank you.
I'll send a couple things by link as I come.
Yes, excellent, thank you very much.